Hello. I'm just going to give it a couple of minutes for folks to join.
Good afternoon. Beth Ludwig has joined.
Good afternoon.
Good afternoon. Jamie Sullivan is joined.
Good afternoon.
Hi, Cara Andrioli has joined.
Hello.
Hi.
All right, we have a good group, so why don't we get started? Good afternoon, everyone. Welcome to the April meeting of the Endometriosis Working Group. So good to see you all. Sorry we missed last month. Thought it would be helpful, and I know some folks have already jumped in, but go around and do some introductions. So I'm Jillian Gilchrist, State Representative, and I'm going to just call on the boxes as I see them. So Marge, do you want to go first?
There, I unmuted myself. I finally got back to a meeting.
Yay!
I'm Marge Frith. I live on Cape Cod. I'm kind of a senior member around here. I'm going to be 90 in a couple of months. Had a hysterectomy when I was 25 and still have hot flashes. Imagine that. That's why I'm here, because I'd like to see this whole nonsense about endometriosis get fixed before I meet my maker.
Thanks for being here, Marge. Good to see you. Heather.
Hi, everybody. Heather Guidon, Center for Endometriosis Care. I am glad to be here and see all of you and looking forward to our chat today.
Wonderful. Brian.
Good afternoon. I'm Brian Kenoyer, Director of Government Relations at the Connecticut Hospital Association.
Dr. Luciano.
Hi, I'm Danielle Luciano. I am a minimally invasive GYN endometriosis surgeon over at UConn and also co-director of our EndoRise.
Wonderful. Jenny.
Hey everyone, good to see you. My name is Jenny. I'm the project manager for the Menstrual Equity Project at the Diaper Bank of Connecticut. We're also the Connecticut chapter of the Alliance for Period Supplies.
Wonderful. Fatima.
Hi everyone, my name is Fatima. I work at Rune with Mackenzie, and we're excited to be here to give a little presentation today.
Wonderful. Thank you. Mackenzie.
Hi everyone. Yes, from Rune Endometriosis. Previously was at the Mental Health Coalition. So very passionate about health, education, and wellness. Nice to be here. And Marge, I'm a fellow Cape Codder, so it's nice to hear you're on Cape Cod.
Wonderful. Glad you're here. Aria.
Hi, good afternoon. I'm Aria. I'm an endo patient and I work on political advocacy in New York State.
Wonderful. Glad you're here. Bridget.
Hi everyone, Bridget Aliaga. I am a behavioral health program manager with Demas Women's Services.
Wonderful. Dr. Martin.
I'm Dan Martin. I'm the executive and medical director for the Endometriosis Foundation of America.
Wonderful. Bria.
Hi everyone, Bria Mulanguzi, formerly Gadsden. I am an endo patient myself, and I work at the Harvard Foundation for Public Giving.
Janet?
Hi, everyone. Janet Stolfi Alfano, CEO of the Deborah Bank of Connecticut and the Connecticut chapter for the Alliance for Period Supplies. It's great to see you all.
Well, Jamie?
Hi, Jamie Sullivan from Aspire Women's Health, and now we are working on a diagnostic for endometriosis, and I run the ARPA-H program for creating that diagnostic.
Great. Kara? Kara Andrioli, you want to?
Yes, hi. I'm a registered dietitian in Glastonbury with a special interest in women's health. And I do counseling and have education packages for endometriosis and other women's health conditions.
Great. Thank you for being here.
You're welcome.
Sarah?
Hi, I'm Sarah Mackwicki. I am an intern with Julian Gilchrist, and I am getting my master's in social work with concentration in public policy.
Wonderful. Caroline?
Hi, I'm Caroline. I am a postdoctoral associate at the Jackson Laboratory under Dr. Elise Courtois. So I do endometriosis research and a very big advocate of the EndoRise program.
Wonderful. Jamila?
Hi, everyone. My name is Jamela McFarlane. I'm an endo patient as well as a patient advocate. I'm also a program training specialist with Endo Black in the DMV area.
Great. Welcome. Holly?
Hi, I'm Holly Dandurand. I'm stationed in California for our chapter of Extra Pelvic Not Rare. We're headquartered with Wendy Bingham in Washington State.
Great. Thanks for being here. Casey?
Hi, my name is Casey. I'm a clinical research assistant at UConn Health and also the research coordinator for the EndoRise program.
Great. Elena?
Hi, everyone. My name is Elena Curry. I'm a nurse anesthetist at Mount Auburn and an endometriosis patient.
Wonderful. iPad 74. I know you said who it was, but I've lost track.
Hi, it's Beth Ludwig. I am an endo mom, and I am very happy to be here and happy to learn some of what the Jackson Laboratory is doing. It's so amazing. So thank you, everyone.
Thank you. Liz?
Hi, everyone. Liz Gustafson. My pronouns are she, hers. I am the Connecticut State Director with Reproductive Equity Now and also someone with endometriosis.
Great. Thanks for being here. Kaylee?
Hey everyone, my name is Kaylee. I'm a patient and an advocate, and I run the support group for endometriosis here in Connecticut.
Wonderful. Sam?
Hi, everyone. I'm a nurse as well as an endo patient and recently diagnosed with thoracic endo. So after that diagnosis was really inspired to figure out how I can better advocate for other women in the position.
Wonderful. Thank you. Brianne?
Hi there. I am Brianne Clifton, the clerk to the Human Services Committee.
Thank you. Thanks for all your help. Wendy?
Good morning, everybody. Hi, it's Wendy Bingham. I'm a physical therapist, a patient with endometriosis, and I operate Extra Pelvic Not Rare, which is designed to ensure that endometriosis everywhere in the body outside the reproductive system is included in all discussions about this disease. Thank you.
Thank you. And Carol?
Hey everybody, I'm sorry I'm a little sick today, so off mic. I'm Carol Johnson. I'm the founder of Uterine Kind. We are launching With Love Period, which is our direct care offering for people who are having a difficult time getting diagnosed, having their symptoms diagnosed. Endometriosis is a key focus for us, and it's great to be here.
Great. Hope you feel better, Carol.
Thank you.
And just to let everyone know, we are on CTN today, and I am realizing that we have so many folks from other states that I should explain what that means instead of just saying it like I say it. So that means Connecticut Television Network. So we're just on our state TV. We're going to start the meeting like we always do. I'm going to give some space for anyone with endometriosis who would like to share their experience or story. Okay. We have an addition, we have I messed up. So we have a piece of the agenda that I forgot to put on there. And so I'm going to first start with our guests from Rune. So I'm going to turn it over to you all to give us a presentation. Thanks so much for being here.
Thank you for having me.
Perfect. Thank you so much. Yeah, absolutely. Thanks for having us. Thank you, Representative Gilchrist. Let me share my screen real quick. I think I need permission.
You now have permission.
Perfect. Thanks so much. All right. Okay. Can everybody see my screen?
Yes, thank you.
Looks good. All right, perfect. Hi, everyone. Thank you so much for having us. It's a real pleasure for us to be here today. This is actually my second opportunity to present with you guys, and so we're really excited to be able to share a little bit more about what we do here at Rune. And so Rune is just briefly a health education platform designed to provide high quality health information to anybody who needs it. We have one of our biggest launches late last year was in endometriosis, and so we're excited to tell you a bit more about that. So a little bit more about us, your presenters. My name is Fatima. I'm an internal medicine physician by background. I've been working here at Rune for the past almost 9 months, sort of on the content side of things and working on operations as well. So doing a lot of the medical side.
And my name is Mackenzie. I've been at Rune for about 2 years now, and I've seen a couple people in the room who have contributed content to Rune, Representative Gilchrist, Jamila, Heather, who is just like a foundational part of this project from the very, very beginning. But we're excited to tell you all a little bit more.
Perfect.
And I thought I just added the slide in. As we speak, if people are curious, sometimes they look up Rune and they spell it wrong or they're confused. If anyone is curious what we're talking about and wants to see it on their own phone, you can use this QR code if you have an Apple phone, an iPhone, but you can also just go to rune.com and you can try it out and ask us questions if that's something you want to do while we present. But yeah, I recommend just going to roon.com and you can go to the endometriosis section.
All right, so a little bit just to tell you about the team behind Rune. We really kind of draw on the strength of a diversity of experiences that have come together to build this organization. We've got a lot of different backgrounds from medical experts, multiple clinicians on the team. We have engineering, design, some folks who have been leaders in other sort of consumer-facing platforms. And so everybody is really here because we all believe very strongly in the mission of sort of expanding access to health education and how that relates to equity and access of medical information. So why are we working on endo? So I know that I'm speaking to a very knowledgeable audience. Everyone here is very familiar with sort of the widespread impact that endometriosis has, not only just on numbers of people around the world that it affects, but obviously on each individual person as well. And of course, everybody's also very familiar with the fact that unfortunately, there's just not easy access to good quality health information out there about this condition, especially it's especially difficult to get answers within the medical system. And providers themselves are often not very well educated, don't have all the information themselves. And so it really leaves this big gap. And so our goal was to sort of try to bridge that health information gap and provide this information into the palm of the hand of anybody who needs it. And so our specialty, which we've done with a few conditions so far, is really trying to help people navigate the landscape of these very challenging health conditions. And so our goal is really to try to make navigating endometriosis less difficult. So a little bit more about what we are. We are a mission-driven health education platform, as I mentioned before, and our mission really is to provide everyone who needs it with free access to trusted medical information. We're a video-based Q&A platform, and so we're really trying to replace Dr. Google with good quality information from experts that you can trust, which are both medical experts, but then also people who have lived experience, so people who have gone through the condition who can share their own experience, which is really, we feel a core part of our platform, and we've gotten a lot of positive feedback from our users about having that access to that kind of information as well. We have thousands of videos that you can either watch or you can read the transcripts if that's something that is easier for you to do. And beyond endometriosis, we're also helping people navigating a bunch of different conditions, including menopause, fertility, and family building. We've done PCOS, so we have products in ALS, dementia, and glioblastoma. And in addition to that, we're currently working on releasing a full suite of gynecologic and women's health conditions, excuse me, including things like contraception, vaginitis, we have HPV, and sort of general health maintenance and screening, miscarriage, and sort of a bunch of other conditions to come soon. So a lot of exciting things in the works.
Yeah, and so here you can see what it looks like, and I put the link in the chat in case it's helpful for anyone. But kind of as Fatima mentioned, I think when you're going through something challenging and hard that's health related, there's the medical aspects to it where you really need an expert opinion. You don't want to be finding your information off of Reddit. But there's also like the social and emotional parts of navigating the condition, and that's where interviewing folks with lived experience, we'll speak a little bit more about, is so important. So here you can see there's like a range of topics on the bottom, from like the basics, symptoms, diagnosis, and within that you'll find that there's kind of intro level stuff, but then a ton of nuances that are addressed here too. So scenario-based questions, like getting a second surgery, and considerations around that, rather than just like what is a treatment for endometriosis. We get into, you know, every possible aspect, hopefully, that someone could be curious about. But of course, we're continuing to build it out. There's always so much more we can do. But this is what it looks like, and the link is in the chat for anyone who wants to play around.
Perfect. And so one of the major strengths, I think, of our platform is the experts that we have on. And so we do have sort of specialists from top institutions around the country, people who are really passionate about their field, and have done a lot of really good work in their field, but also are with us because they're really passionate about health education and access. And so this is something that really kind of drives them to want to contribute and work with us. We're constantly expanding our network of providers and experts. We have a really robust network of referrals. And so people who are passionate about things like health education tend to know other people who are passionate about it. And so we get to, you know, every day we're adding new providers and experts in a bunch of different fields. And we also have a system for review, because that's really important. We want to make sure we have good quality information. And so we have health professionals who are experts in each of these areas that we're producing content in. And so that is kind of our review process that all of our content goes through as well.
Yeah, and so as I said, along with all the medical experts, I see Dan Martin is here too, and he's also a great contributor to Rune. But along with all the medical experts we have a lot of incredible lived experience speakers, two of whom are on this call, which is so exciting. But I actually love that you can kind of get a sense of some of the questions that you can learn from here. So like on the right, you'll see like, how does endometriosis impact you at work? And our hope is like, this isn't a formal talk. It feels like you're FaceTiming a friend who just gets it, who sees you, who like has been there. And it's not intimidating, it's delivered empathetically, and that's why video is so important here. But yeah, a lot of really critical lived experience content that we don't want to put below a medical expert. We think that this is all like on the same stage and for a reason.
Perfect. So hopefully some of you guys got the chance to look at it while we were talking, but what I'm going to do is pull up the platform and just give you a brief tour. All right, so when you log in, it's free to use, but it does ask you to sign up. And so when you log in, over here on the side, when you first log in, you'll get some questions about what conditions you're interested in. You can provide some information if you want. It gives you a more tailored experience. But over here, we have a drop down. So in case you're interested in learning about other conditions, you can access the other conditions we have as well. The home page here, if you've provided some information, will give you some things that are kind of more focused on what you said you're interested in. We have questions that you can browse, some topics that might be of interest to you, and some experts. But there's ways to get much more in depth in this information. So the Explore page is basically where you can get to the meat and potatoes of all of our content and organized in a way we hope is easy to use and follow.
But
and so we have it divided up.
I can't see your screen. I could be the only one, but I don't see it anymore.
Oh.
Does anyone else see her screen?
I still do.
I can
Oh, so
see it.
it's just me then. Okay, I'm having an issue. Sorry.
Okay, oh no.
Sorry.
No worries. No, I'm glad you flagged it though, just in case, because I wouldn't want to do the whole demo without anyone being able to see it. But so this page, Explore, divided up into different topics. And so say you're interested in learning more about symptoms generally, you can click in here and we have them divided up into different symptoms. So you just want a general introduction, you're interested in menstrual symptoms, learning about fatigue and how that can relate. And so you can click on one of these, and then my computer's also a little slow. And then you can get access to our individual questions and answers. And so for a lot of them, we have multiple perspectives and experiences, or just hearing from different experts is often helpful. Getting a second opinion is difficult in real life. And so you want to make that experience as easy as possible as well. And so if you click on one, you get to the video. And so it will show the question, and then it has a transcript pulled up here. And you can also read if that's easier. I'm somebody who's very visual, so I like to read the answers, but some people like to watch the videos, and then you can kind of scroll through and see perspectives from different people as well. So you have like a couple of other answers up here too. And so that's one way to access the content. There's obviously a lot of questions. We have thousands of answers on here. And so another thing that I think is really powerful about our platform is Ask Rune, which is essentially an AI-powered instant answer. It doesn't pull from everything on the internet. It's just AI that pulls from our transcripts and our content on the platform. And so this is a way that you can really, I think, access the depth of the information that we have, and really easy to use. So if you had something that was on your mind, say you're, like me in my 30s thinking about fertility, egg freezing, and you had a question that you just wanted to ask, should I freeze my eggs if I have endometriosis? And you can type in your own question. And then it basically pulls from our transcripts. And so it's going to provide a summarized answer pulling from different videos. And so you can read that if that's kind of the way that you like to get your information, but it also directs you to the videos that it pulled from. And so if you want some more information, you want kind of more in depth, you can watch some of these videos and hopefully get a pretty thorough answer to your question. Over here, we also have all of our experts. And this is helpful for folks who might be looking for a perspective on our platform, or you want to know, who can help me understand more about mental health considerations from endometriosis or holistic aspects of treatment. I apologize about the delay, but this is a way, hopefully it'll load soon, that you can kind of have it all.
Oh, we lost sound.
Oh,
there you are.
One more time. Otherwise, if we can't show you, it's one of my favorite parts because it's like nice to be able to see.
I can show it.
She might have frozen again. I think, oh, there we go.
Fatima, do you want me to show it?
Yeah, do you want to?
Yeah, that's totally fine.
Okay. Sorry, there might be something up with my...
No worries. Let me... Okay, I will share screen. Yeah, the excerpt page is incredible.
I know, I really want people
so
to
I agree with you. I think access to people on video who are typically already hard to get appointments with is such a strength here. And we've also found that by organizing people by specialty, a lot of people living with endometriosis or thinking they may have endometriosis actually are realizing who could be a part of their healthcare team, which sometimes isn't immediately clear. And that's really understandable. But like having a pain medicine specialist on the platform for a lot of our users has been like, wow, I didn't even know that maybe I should be trying to see a pain medicine specialist, or that that was a thing. So understanding all the different potential members of your care team here and being able to learn from them, even like someone who helps care for someone living with endometriosis and being able to learn from them. So a lot of incredible experts here, including lived experience speakers who we feel really grateful to be able to provide some incredible content from. Fatima, is there anything you wanted to add, or do you want me to get into the next part of the presentation?
No, that was it. Yeah, we can go to the next part.
Awesome. Okay, so now I will move to here, and thank you all for listening to us share. Okay, let me present. Can everyone see my slideshow?
Yes.
Okay, so we wanted to share, we know that this group in particular, when we think of like where are like leaders in advocacy and in the field gathering, people who have really strong opinions and potential feedback for us, where might they be? This is clearly a top choice. So the first way that we're looking for some help is always just like feedback, positive and negative. We're trying to make this better. We're trying to fill in gaps. We're trying to learn where we may be weak. So if you haven't tried Runa already, or if you tried it in the fall maybe and haven't tried it again, we've added a ton of new experts, new perspectives, new ways of digesting content. If you have any thoughts on it, always feel free to email me. I'm going to put my email in the chat after this, but would love to hear from folks if this is something they end up checking out and having feedback on. The next is just sharing it. We're trying to make sure that we are helping as many people as we can. And so I wanted to just call out that like ways that this has been shared in the past that has ended up being super impactful for folks has been oftentimes in support groups. And so that's how a lot of our users have learned about this is someone in the support group shares. So if anyone is a member of a group and thinks that this would be helpful or appreciated, we'd love for you to share it with your support group. Any other organizations or communities, if you're on an email list where you think there's people who may benefit from this, we're just trying to reach any group of people where maybe we aren't initially or connected right now. So that's always super appreciated. And then exciting news is we're doing a webinar on Thursday. And so this is our last thing we wanted to share, but we haven't done one of these before, and we brought together a group of incredible panelists to share on this topic in a lot of different ways, like how to be heard in healthcare and very practically what advice can be offered to people living with endometriosis, but then kind of taking a step back, like what is happening in the policy landscape, in the advocacy landscape to help people be heard in the future, hopefully in the near-term future, and offer some insights there to people who are curious. And the response to this webinar has just been incredible, but I'm sure there's groups of people who haven't heard about it that would like it. So I'll share a link in the chat with like a flyer for this. If there's anyone you know who you think would be interested in this, it's completely free and it's on Thursday. And we'll have the lived experience, the medical expert perspective, and we'll have Representative Gilchrist. So very much looking forward to that. But yes, my email will be in the chat. A flyer will be in the chat for this. And if anyone has feedback, good or bad, we want to make this better. So please let us know. And just thank you so much for letting us present. And we're happy to take questions too.
Wonderful. Thank you both for being here, for presenting, and for the work you're doing. It's so important and so helpful. Any questions from folks? I'll look for hands. And I don't see any hands. All right. Wonderful. Thank you so much.
Thank you.
All right, we're going to move on now to the next piece of the agenda, which which is a legislative update. So just to let folks know where we're at in the legislative session is that most of the committees have finished their work except for the two money committees. So the Appropriations Committee and the Finance Committee are still working on their budget proposal. And that is where the money for the biorepository would fall. So a recommendation has been made to the Appropriations Committee to increase that funding for the biorepository, making the argument that during these times in our country when research dollars federally seem to be jeopardized, what an opportunity we have here in the state of Connecticut to continue to move forward with an investment in the biorepository. And so we will know in the next few weeks if that money gets included in the Appropriations Committee budget recommendation. And then what happens is whatever comes out in that budget is negotiated with the governor's office, and our legislative session ends June 4th this year. So that's where we are with that piece of the process. The only other bill I have an update on, and then we'll turn it over to the group if they have any additional updates, is the fertility proposal that we've discussed for a few years now. This year's proposal was scaled back a little in terms of the fertility treatment that would be offered, and it is only specific to Medicaid. So currently in the state of Connecticut, there is infertility coverage, a very basic coverage, but a coverage for private insurance. And so this would expand on that coverage, but only for Medicaid, thinking that in future years we would push for the private insurance to cover that piece as well. For those who've been around for a little bit, we had been trying to kind of go full shebang with a pretty comprehensive package for both private and Medicaid. This year, we are trying our incremental approach. And so that bill did make it out of the Human Services Committee and is awaiting a vote in the House of Representatives. For anyone else here in Connecticut, if you have bills you would like to share with folks, please just raise your virtual hand and feel free to jump in. And if anyone has any questions on what I presented, please feel free. Okay, seeing none, I'm going to turn it over to Heather, who has graciously offered to give a federal update. Thank you so much.
Oh, absolutely, absolutely. I am going to try to just share my screen. I think it's a little bit easier to go through it this way if I could. Can everybody see that?
It says that you've started sharing, but we can't see your screen.
How about now? Still no?
No, and interestingly, your camera went off, so I don't know what's going on with your computer. Now
Oh, well, that's helpful, isn't
now
it?
it's there. Now it's all there.
Well, let's see. Okay, it says now you can see my application, so I'm going to go with that, right?
See it. We're good now.
I see it.
Okay, great. So first of all, Representative Gilchrist, thank you. There's a lot of chaos going on at the federal level and at the local levels right now. There is a lot of we don't know. We have suspicions, we have we have concerns, we have thoughts about what may be things to come, what may not come. There is a lot of chaos going on right now. What I talk about today may change tomorrow. So I do want to ask also for a little bit of grace because some of this information is not public, okay? And what I mean by that is there are a lot of us doing a lot of ad hoc work right now with off-the-record groups, and that is for insiders' protection. So if you see things that are not sourced, that is by design, and I'm going to ask for your grace on that. Folks are very concerned right now about their jobs. They're very concerned about funding. They're very concerned about a lot of things. And so I have gone off the record in a number of areas. Other things are very public. So let me just take you through sort of the, kind of the lion's share of what we're looking at, right? So what do we know? We know that the new secretary was allowed to promise to be go wild as it was. And in response, he has gone wild. He is living up to his promise. With regards to that, we know that the HHS, which is a $2 trillion department, is really facing unprecedented changes right now. Some of those changes are not all doom and gloom. Some of them do relate to excess and waste and things that could be trimmed back or otherwise combined and streamlined, which would help us. Other things we're not so sure about, and other things we may need to sound the alarm about. We know that there's new personnel coming in every day. They do not necessarily share our goals. So again, there's some cause for concern. When we look at the very topical, high-level scope of cuts, we are talking about a significant number of bodies. We're talking about ranges from 300 at CMS all the way up to 3,500 at the FDA. That's not insignificant. There were already 10,000 let go. We're looking at reducing the workforce down to 62,000. And this is not supposition by an ad hoc insider group. These are sourced facts. So there is reason for concern for that. RFK did make a statement specifically mentioning key priorities, quote unquote, like women's health, which he felt sort of lacked focused and kind of belonged in what he called an uncoordinated resource area with a lot of redundancies. I personally disagree that there's any redundancy. We already suffer from a shortage in women's health to begin with. To that end, he's looking at closing 5 of the highest cost regional offices, unsurprisingly, within large cities. It's pretty obvious everybody on this call can understand the scope of that. When we talk about closing large offices, we're talking about reducing large functions. That relates to redesign, restream, and quote unquote, no services being lost. But that remains to be seen. Restructuring doesn't always work in our favor, as we've seen before. So we're not necessarily sure what that's going to look like. What we do know, when we take it again at a very topical level, and again, I present this from a purely neutral, bipartisan perspective, we do know that it disrupts or has the potential to disrupt patient care and health services. There is no question at all that the NIH scientific research capacity is significantly reduced. That is specific to endometriosis and every other research area. We know that public health response will be diminished. And we know that despite claims to the contrary, we know that there is some risk to the FDA and the safety of our infrastructures. Now, some of the things that we have reviewed in the last month, specific cuts that we're looking at, and or increases, as luck would have it. The Department of Defense received a $6 billion increase. Non-defense programs saw a $13 billion decrease, however. So under the continuing resolution, the cuts were very selective. Military medical research, under which women's health is incorporated, was cut by 57%. That includes important things like ovarian cancer, lupus research, diseases and disorders that predominantly impact those assigned female at birth. We know that the NIH Innovation Fund was cut by 69%. And even though the Department of Defense had some new things granted to it, those initiatives did not extend to civilian health research. Also of concern, for the first time ever, there has been specific language removed and or bundled in, which really gives RFK Jr.'s team specific discretion over funding. It should come as no surprise to anybody here. It is not a secret. It is public information. The DEI aspect of much of our research has been significantly impacted. And although you may not think that has much impact on endometriosis, even the simple incorporation of a statement saying endometriosis affects women, girls, and gender diverse individuals, which is a fact, has set up some research and some articles to be pulled. I can think of Dr. McKenzie as one of the articles that was pulled because he simply mentioned the word transgender individuals. We know that appallingly, Dr. Diana Bianchi was quote unquote asked to find other employment, shall we say. She was a key player at the NICHD that was a very big advocate for endometriosis specifically. ARPA-H did survive the budget cuts, but there's no new women's health sprint specified. So that's important. these parts of the information here that you see is public information. As Sean Tipton put it, who is a colleague at ASRM, how you can eliminate entire divisions, such as those for maternal mortality under women's health is beyond me. I share his thoughts. We know that certain child and maternal health programs have been hollowed out. That is a fact. These are departments that impact the most vulnerable among us: reproductive health, maternal health, women's health. These things are either being eliminated or folded into other areas, and we don't know what that's going to look like. So these are things of concern. Of no surprise, as I said, many folks have been laid off. There have been travel bans to scientific conferences. For those of us who attend these conferences, we know that this is a way not only to engage in the collegial spirit, but to obtain the most recent education on evidence-based education and information. So that's of concern. We know that billions have been stripped from local and state health departments. If you are like me, you work with your local health department on endometriosis education. So again, although it doesn't specifically name endometriosis and women's health, you can reasonably expect that we are going to feel these cuts one way or another. They may come in the form of pharmaceutical costs. Perhaps folks can't afford up-and-coming pharmaceutical solutions for management of their disease. Panels have not been able to meet. I belong to a specific clinical trial panel. We have not been allowed to meet because it has FDA staff. So all of these things are very real. They do have implications for endometriosis. Right now, the Office of Research on Women's Health does not have any funded opportunities. The portal for discovering women's health research is gone. Whether or not that remains to be rebuilt, we shall see. I do not know. No one seems to have information on that. If you want to look just sort of at a glance, some of the studies that have been terminated, there is an entire list of several hundred studies. Places like Columbia, Brigham's, Johns Hopkins, they have lost their funding on things like reproductive health service studies, opioid research, subfertility among Black women, breast uterine cancer, real studies that impact real people. So again, the concern is there. And that's not, to say nothing of staff demoralization, exhausted employees, burnout, pushbacks, which can really delay efforts and progress to the extent that things are being tied up now in the pipeline and in the courts, unfortunately, because for every action, there has been a reaction. This is just a very small sampling. Some of the pushback from the NIH lawsuit challenges that are being brought forth by some folks. It should come as no surprise that some major public health, including the country's largest and most important public health entity, has called for Secretary Kennedy's resignation or firing. So there's a lot of political back and forth going on. Again, we do not know how this is going to specifically impact several or any or some of these specific endometriosis bills. State of Minnesota has one, which is an exact copy of ours here in Connecticut as far as establishing a data biorepository. There is a New Jersey bill which has passed. I do not believe that it has received the funding. I'm not 100% certain on that. There's a Massachusetts bill, whoops, let me back up, which again specifically formulates itself on our bill. And there's a couple different parts to it. You can look it up at All Paths or just jump on the legislative search engine and run it. And you can see that they too are trying to do the biorepository, much like EndoRise. When I tell you that EndoRise is precedent setting and Representative Gilchrist is the first of its kind, I mean it. Folks are taking notice. They want to do it in their own states. I do not know if they will be dampened by the current state of affairs. Same thing for the Virginia bill, which is sort of languishing on the governor's desk. That relates more to menstrual education, as same as in Texas, relates more to menstrual education, in which endometriosis is incorporated. But we don't know. We don't know if there's going to be a dead standstill. We don't know if we're going to be able to get them through, under other bundles, if you will. So we have to be very realistic. We know that we can't boil the ocean. Sometimes as our groups are getting together, what we're understanding is that sometimes success really looks like preservation. And what that means is making sure that the Office on Women's Health doesn't go anywhere, that our relationships aren't going anywhere. We still encourage you, keep active with your representatives. I have not been in any meeting in which Representative DeLauro's name has not been thrown about, or she has not been there herself. There are a lot of women's health champions like Representative Gilchrist, like Representative DeLauro, like so many others out there who are doing everything they can. Get in touch with your own representatives, make it personal. Talk about your district, talk about your health, what that looks like. Ask them for funding. We have to keep moving forward. We can't just stay at a standstill. To that end, we have looked already towards the 2026 appropriations. They are now underway. You can ask for support of these efforts right now. Specifically, our ad hoc agencies, there are 510 of us working together. We've asked for $51 billion for the NIH for fiscal year 2026. That's a $4 billion or 9% increase over this year's levels. Specifically asking for $200 million for the NIH, specifically for women's health, $5 million to the FDA for the women's health pathway. We're looking at including language in the DoD funding, things like menopause. Again, we never stop asking for endometriosis. That's just a given. ARPA-H funding, we're still asking for a lot of money for that, $200 million increase over 2025. The appropriations are there. We are continuing to ask. We need your help. Collectively, we know what is going on right now is a disruption to the scientific and research infrastructure. We know that certain public health initiatives, no matter what side of the aisle you sit on, we know they're being hindered. There are real legitimate concerns about science being politicized. We know that the infrastructure may look different, but that doesn't mean that the spirit of our advocacy looks different. If you are involved in endometriosis and women's health, as many of us are professionally, we know that the gutting and the underfunding of our research is hardly new. We're used to this. This is where we thrive. Now everybody else is seeing it. So take your lived experience, use your grassroots advocacy, continue to drive that change. We know that these are crazy times right now. Tomorrow we could have a different look altogether. What I would say is continue to support the effort of groups like this one, other women's health groups that are out there trying to establish the funding, but be in touch with your legislators. That this is where we thrive. This is what we do. So with that, I will throw it back to Representative Gilchrist.
Thank you so much, Heather. And thank you for ending on the advocacy and
absolutely.
What we can do.
This is what we do.
Yeah, this is what we do. It is overwhelming but important to see what's going on federally. And so I'm glad we have this information. And then bright spots. It's pretty wonderful that there are states, pushing for change at the state level. So thank you so much for this update. And I'm thinking next steps, everybody. I will draft a letter I'll work with you, Heather,
Sure.
from this group to the federal delegation to support the funding requests, because I think that could be good from the working group. Great.
Absolutely.
Any questions or comments from folks for Heather? All right, thanks again, Heather. With that, I'm going to turn it over to Endo Rise to give us an update.
All right, I am so sorry. My computer decided to crash on me as we were waiting for you guys as I was watching. So I got in and out of all of this. So I'm trying to send my slides to this computer so that I can pull it up for you guys. But either way, just
because
wanted
I
to
talked too long. I'm sorry, Danielle.
Oh my gosh, no, it's not you, Heather. You're amazing. I just wanted to make sure that I had pictures from the Endo Summit so that we could talk about all the wonderful things that we've done. So hopefully my slides will come here. But let me just tell everybody that basically what we've been doing over the last couple of months, we've had some pretty great advocacy events and education events. I guess I'll just do it without my slides and the pretty pictures. And if they show up, then I'll show you guys the pictures. My goodness. All right. I am so sorry about this. This is very much unlike me to have all this craziness, but all right. So the first thing that I wanted to talk about was some of the awareness activities that we've done. So at UConn Health, we did an endometriosis podcast. And then we also had up, our building was all lit up yellow for the month of March, which was really nice, so that everybody around wondered why it was yellow, and we got to tell them why. And we also, so they posted that our podcast that Yasmina and I did, and then also they had on the, so we have like these computer screens in our waiting rooms and in our lobbies, and there was like a little video of each one of us saying like one blurb about endometriosis and raising awareness about endometriosis. So that was one thing we did specifically at UConn Health. And then one of my fantastic patients, adolescent patients, did a great interview on WFSB for Great Day Connecticut to talk about adolescence and endometriosis. And she did a beautiful job talking about how endometriosis affected her life in the high school and how she wishes that her school nurses and her doctors and her pediatricians had known more about this. So I thought that was really great. And I can send some of these links and the slides once I can actually figure out how to get the slides to work. And then we also did some awareness just last week at UConn up in stores. We did a below the belt screening on April 10th, and we had a panel, and it was really great. Actually, it was student-led, a student group that led it up at UConn Health. They even made really cute bracelets, and I have pictures of the cute bracelets, but they made really cute bracelets for us all to wear, and there were physical therapists there. Arlie was there. And some of the physicians, and then Dr. Courtois to talk about research. And afterwards, poor KCD, who's on here, has gotten like, I can't even tell you how many emails from the college kids who want to do stuff over the summer to participate in Endo Rise. So one of our goals is to come up with little projects for them. So Rep Gilchrist, if you have any projects for college kids over the summer to do, they are looking to be involved in this and in women's health. And that was just really exciting. So it just goes to show that we're spreading some good words. And then in terms of education, Yasmina and Dr. Newmark, who's one of my partners, she spoke at the Connecticut Nurses Association about endometriosis. And she and Yasmina have been doing surveys for all the school nurses to look to see kind of pre and post what their knowledge is about endometriosis and what they gained out of this, out of the talks, and then what they would look for in terms of resources, and really great feedback about what, the number of people who had heard of endo but didn't know what to do about it versus the number of people that didn't even know that endo existed. And then afterwards, not only knew about it, but knew how to find resources. So that was great. And then at the end of March, Elise and I were invited to Endo Summit and got to be on this fantastic panel with this crazy moderator that nobody would recognize, Heather, as our moderator. And our talk was about getting fired up in terms of legislation. And it was really fun to be a part of that and to show what we've been doing in Connecticut. And really met a ton of great people. In fact, one of the people I met there is a physical therapist from Eastern Connecticut who I didn't even know was out there doing endo PT, and just met her as we were sitting at the airport or on our way to the airport. And so she was actually part of the panel up at Stores because that's nearby where her office was. So really just growing our community and, wanting to put all these names and stuff into our EndoRise website. Because, one of the things that I remember we talked about at the beginning of all of this, oh, my slides finally came through, whatever. One of the things we talked about at the very beginning of all of this was how we wanted a centralized resource and we wanted a place for patients in Connecticut to find people like them, to find resources for people to help them. And it's just beautiful to see that growing with all of us kind of connecting and meeting each other. So that was really fun. And then on a research and biorepository thing, we have now over 3,000 samples and 63 patients in the biorepository. And next week, we are starting our year 1 longitudinal sample collection. So we're actually going to be getting our samples and our surveys from our 1-year outpatients, which is really exciting. And we are onboarding Danbury Hospital right now, just working through the last legal logistical stuff. So it'll be UConn, St. Francis, and Danbury. So we're really spreading around and getting a little bit of everybody. We did some research presentations at the Endometriosis Foundation and also May Day. And then one thing we also did was last week, because of this research funding situation, and unfortunately, one of the colleagues in my department lost her NIH grant because she was talking about equity for reproductive health care. So that obviously is all sorts of bad words. So she lost her funding. And so we had kind of an emergency meeting with JAX people, maternal fetal medicine people, complex family planning, REI, MIGS, Urogyn, cell biology, leadership from the hospital, fellows, and then research faculty and staff, just to kind of talk in a big group about ways that we can work together to help each other to fund research and work on research and work together, free resources that we can share amongst each other so that we can continue to work through these difficult times. So I just, again, another example of how EndoRise and this group has really brought people together to work towards things. And, I think this is the power of groups like this and people like this is forming communities. So I will forward some of these links and maybe someday figure out how to pull my slides up, because I did have some pretty pictures of all of us at Endo Summit. But anyways, that's my story.
Well, that's fantastic and tremendous work being done. And yes, if you want to send that over, we will email out the slideshow to folks. But thank you. What amazing work. And I always get very excited to hear the updates on how many samples. So that's fantastic. Well done.
Absolutely.
Great. Any questions from the group? All right. Well, thank you all. This was a lot of fantastic information in an hour amount of time. So glad we were able to get this in. Want folks to save the date for our next meeting, which will be May 12th. We'll do 1 o'clock. And just truly, and if you have anything you think we should update the group on, please send it my way and we could get that on the agenda. Anyone have any final announcements for the good of the group? All right. Thank you all so much.